So of course it's going to vary from person to person. So some of the common things are, it's of course going to feel tight in your chest. A lot of women describe tightness. Not everybody has pain, so if you don't expect pain, don't be surprised if you don't have pain, but everybody will have tightness. Your muscles sit on your rib cage, and now they're going to sit over an implant. And interestingly enough, it doesn't always correlate with the bigger the implant, the more discomfort. I've done augmentations on women who have put quite large implants and have really no pain, and sometimes I'll do a small, relatively small augmentation on somebody, and they'll seem to have a disproportionate amount of discomfort. So it doesn't always correlate, but of course it's going to feel tight. Of course they're going to feel hard because, again, everything's being stretched. I've had patients call me, and I've read online with questions where people say, oh my goodness, do I have capsule formation? Is it getting scarred? It's much, much too early. It's going to be tight. It's going to be hard. The other thing that's very important to be aware of is you have two breasts, but they're very much going to feel different. It's very, very common for one side to be more sore. People will describe tingling, a little like electric shocks, discomfort, sometimes you'll get bruising, and it's very normal. You might have only on one side. They're also going to swell differently. After a breast augmentation, everybody swells. Everybody swells disproportionately up top, so the implants will look like they're placed too high. It's going to vary from person to person. And again, both breasts will swell differently. Now, of course, if one looks like a basketball and one's very tiny, you of course need to let your doctor know. But if you just have some mild or moderate differences, that's very common. And remember, your swelling and the settling take a full 3 months. So those are the commonest things to be aware of. The only other thing I'd like to highlight is it's very normal to get a little bleeding from the incision. So again, nothing to be concerned about. Most of us put local anesthetic in the area even though you're being put to sleep for the operation. And when that wears off, there's epinephrine in the local, and that stops the bleeding. And when it wears off, sometimes you get a reflex. So it's very, very common to have a little bit of oozing of blood. So if you're concerned, of course, reach out to your doctor, but you don't need to panic if there's a little bit of bleeding. And again, there'll be different sensations in both nipples. And again, you have to be patient. You need to think of this as at least a 3-month settling period, and you'll keep improving and getting softer for an entire year.